Welcome and good afternoon, everyone. My name is Allison Jones. I'm Director of Program Strategy and Management here at the Alliance for Health Policy. We are a nonprofit, nonpartisan organization dedicated to helping policymakers and the public better understand health policy, the root of the nation's healthcare issues, and the trade-offs posed by various proposals for change. We're thrilled to be presenting today's webinar, 2024 Voter Priorities in Healthcare, Telling the Policy Story. The Alliance has served as a trusted educational resource for the health policy community for more than 30 years, and today's webinar will explore the role that healthcare issues will play in the upcoming 2024 presidential election, discuss the latest polling data, and provide insights into how reporters can use storytelling in dynamic news coverage. We're excited to showcase the different viewpoints and perspectives of our fantastic panelists as we look ahead to what to expect during this upcoming year. Before we get started, I want to take a moment to thank our event sponsor. Today's webinar is generously supported by the National Institute for Healthcare Management. We are grateful for your support of this program and for all you do to improve healthcare by advancing diverse perspectives on health. I also want to share a few quick logistical notes. Today's panel has a Q&A session at the end. We encourage you all to be active participants, so please feel free to share your questions at any time. You should see a dashboard on the right side of your web browser that has a speech bubble icon and a question mark. You can use the speech bubble icon to submit questions you have for the panelists at any time. We will collect these and address them during the Q&A. Throughout the webinar, you can also chat our team about any technical issues you may be experiencing, and we can assist you. If we don't get to your question, please don't hesitate to reach out to us at events@allhealthpolicy.org, and we'll do our best to connect you to additional information. And don't forget to follow the Alliance for Health Policy on LinkedIn to stay informed about upcoming events like this one. You can also find us on Facebook and YouTube. With that, I'm so pleased to introduce our panelists for today's webinar, starting with our moderator for today's event, our President and CEO, Claire Sheehan. Claire Sheehan is the Chief Executive Officer at the Alliance for Health Policy. She's a dynamic executive with more than 25 years of experience effectively engaging others to catalyze change in healthcare and health policy. Claire has served in leadership roles in associations, corporations, consulting, and communications firms, including GMMB, the Blue Cross Blue Shield Association, Fleischmann Hillard, the Generic Pharmaceutical Association, Avalier Alexion Pharmaceuticals, and others. We're so grateful to have Claire with us today. I'm also pleased to introduce our other esteemed panelists, including Liz Hamill, Vice President and Director of Public Opinion and Survey Research at KFF. At KFF, Liz oversees the team that is responsible for the KFF Health Tracking Poll, the COVID-19 Vaccine Monitor, and ongoing survey partnerships with news organizations such as the Washington Post, Los Angeles Times, and CNN, and more. We also have Rachel Korzang. Rachel is the Chief Washington Correspondent for STAT, reporting at the intersection of politics, business, and health policy. She's also the author of the twice-weekly DC Diagnosis newsletter and leads STAT DC's bureau. She previously covered healthcare policy for Modern Healthcare and prescription drug pricing for Inside Health Policy. Rachel earned a degree in journalism from the University of Southern California. And our heartfelt welcome to our final panelist, Annie Linsky. Annie is a White House reporter with the Wall Street Journal, and she's covered politics and policy on the state and national level for 20 years. You can read more about Claire's background and the bios of our other panelists on the Alliance website. And with that, I will turn it over to you all.
Hello, everyone. Hi, I'm so happy to be here with you today. If it looks like I'm in a hotel room, that's because I am. I'm coming to you from Atlanta, where I'm at the American Association for Public Opinion Research Conference. So before I get started, I just want to say that, at KFF, our polling focuses broadly on how healthcare issues are impacting people. And that includes their opinions about policies, but also their knowledge and awareness and their experiences with healthcare. And during election seasons, we also look at how healthcare issues are factoring into voters' decisions, but we do not really do horse race polling or likely voter modeling aimed at making projections for who will win the election. So please don't ask me who's going to win. If we can go to the next slide, please. So many of you are probably on this call because you care deeply about healthcare, and many poll results will confirm that most Americans care deeply about these issues too. But fundamentally, the 2024 presidential election is not a healthcare election. You know, first off, issues are only one factor among many that voters are considering when they're making voting decisions. Other things like partisanship and candidate characteristics also come into play. And I think we can all agree that we have two candidates in the Democratic and Republican nominees who evoke strong emotional reactions from voters. And it's also important to keep in mind that among issues, there are many other issues that voters are more focused on than healthcare, including things like inflation, immigration, democracy, and the economy. But that said, that doesn't mean that healthcare issues are not important to pay attention to in this election. So first off, the cost of healthcare is really a big part of voters' concerns when they talk about inflation and the economy, and they do want to hear from candidates that they're committed to lowering healthcare costs for people like them. You know, another way that healthcare could play in this election is that there are many existing health programs, including Medicare and Medicaid, and increasingly the ACA, that are popular with voters, and voters may react to messaging that implies cuts or changes to these programs. And then another way that healthcare could be really important is that issues like abortion and some other healthcare issues may not be at the top of voters' lists, but they really could motivate turnout for specific groups that could end up being decisive in what's likely to be a really close election. Next slide, please. So here's a question from our February poll asking registered voters how important it is for candidates to talk about a list of issues. And one important thing to note about this question is that we chose this list and gave this to voters. We may have gotten different responses if we had asked people to name issues off the top of their heads. But among this list, you see that issues like inflation, the future of democracy, and immigration are all near the top of the list. But also note the placement number 2 on this list, 80% of voters saying it's very important for the candidates to talk about the affordability of healthcare. Now, while for many of us, healthcare is a wonky policy issue, for voters, it really is a pocketbook issue. It's a big part of their concerns about the economy and about inflation. So healthcare costs are also an issue that cuts across partisanship in terms of importance. So some other issues you see on this list are more partisan. So for example, Republicans are much more likely to say they want to hear candidates talk about immigration. Democrats are more likely to say they want to hear candidates talk about abortion. But large shares of voters across the board said they want to hear candidates talk about the affordability of healthcare. Next slide, please. So this slide shows you one reason why healthcare affordability gets elevated to the top of that list that voters want to hear about from candidates. When we ask people how worried they are about affording certain things, including things like groceries, their rent or mortgage, gas, and transportation, you see here that large shares are worried about each of these things. So if we look at the blue parts of the bars in this chart, that's the share that says they're very or somewhat worried. But if you notice what's at the top of that financial worried list, it's unexpected medical bills and the cost of healthcare services. And so that's something that worries people even more than affording other basic things like transportation, food, and housing. Next slide, please. So we obviously can't talk about health policy without talking about the Affordable Care Act, and I could give 10 different webinars on all the polling we've done about the ACA over the years. So I'll just touch on a few points about where we stand now regarding public opinion in the ACA. First, we do find now that the ACA as a whole is more popular than it was when it initially passed. Really, since the failed repeal efforts in 2017, we've seen that a majority of the public has a favorable view of the law. So it's about 60% that view the law favorably now. It's not quite at the same level of popularity as more established health programs and entitlement programs like Social Security, Medicare, and Medicaid, but it's much more popular now than it was when it passed. And in particular, many provisions of the ACA are even more popular than the law itself. One notable one are the protections for people with pre-existing conditions. It was mainly the threat of removing these protections that contributed to the previous repeal effort failing. On the other hand, we do find that most people don't believe that the ACA lowered healthcare costs for people like them. And when you connect that to the fact that the #1 priority among healthcare issues for voters is healthcare costs, we don't see a connection between that and the ACA in voters' minds. And then even though the law has become more popular, we do still see substantial partisan division over the law. Favorability has increased among Republicans, but it's still only about 1/3 of Republicans that view the law favorably and 2/3 have an unfavorable view. So, the bottom line is that voters, and particularly Democratic voters, want to hear candidates talk about the ACA, about preserving the ACA, but they're really not looking for detailed policy proposals on the ACA at this point. Next slide, please. So here's just an illustration of one of our recent questions on the ACA. We asked about the next steps that people would like to see the President and Congress take when it comes to the Affordable Care Act. And you see that about half of voters overall want to see the ACA expanded. But again, you can see the partisan divisions on this. If you look at Republicans who are in the bottom line, majorities of them would prefer to repeal the law entirely or scale back what the law does. So on the next slide, please. Another issue that we really can't ignore if we're talking about healthcare issues in this election is the issue of abortion. So abortion doesn't rise to the top of the issue list for voters overall. However, it could play a big role in motivating turnout around certain groups of voters, particularly in states where abortion is on the ballot. And we found in our March tracking poll that voters who say abortion is the most important issue to their vote are mainly made up of voters who are supportive of abortion rights. And that's a change from previous elections prior to the overturn of Roe v. Wade, when most single issue abortion voters were those who were looking to place more restrictions on abortion access. So this is an issue where national polling is a little bit less useful, but polls of specific groups that are motivated by this issue, including younger women or polling in specific states, can tell you more. That said, I think it's worth noting the data that I'm showing on the slide here, which is that at least half of voters overall, including larger shares of Democratic voters, believe that the elections for president, Congress, and their state legislator will have a major impact on access to abortion in the country or in their state. Next slide, please. So finally, I'm just going to show a few findings from our new poll that was just released this morning, good timing, that included a focus on the major health and entitlement programs. So first thing to note is that Social Security, Medicare, and Medicaid are incredibly popular programs, so voters will be listening to hear candidates talk about strengthening or preserving these programs for the future. As you can see here, majorities of voters are also worried about whether these programs will be able to provide the same level of benefits in the future as they do today. And that also includes subsidies for those enrolled in insurance through the ACA marketplaces. Now, I don't expect our leading presidential candidates to engage in a major policy debate over the future of these programs, but we are likely to hear them talked about in the course of the campaign. Next slide. Another thing is that President Biden considers the passage of the Inflation Reduction Act, including the Medicare drug pricing provisions, one of the signature achievements of his presidency so far. But we find in our polling that information hasn't trickled down to most voters yet. So on the left here, you see among voters overall, fewer than 4 in 10 are aware of some of these signature provisions, including the drug price negotiation provision, the cap on insulin. So we see that among voters overall, there's not high awareness of those provisions. If you look in the middle, though, and on the right, you see that older voters and Democratic voters are more likely to recognize that these provisions exist. And we've seen some increase in that awareness in recent months. And so this suggests that Biden's campaigning on the IRA is breaking through with some of these groups among his base. Next slide, please. Okay, so that's it for the data that I'm going to share, but I do want to wrap up with just a few tips for reporting on election polls. First, polls attempting to predict who's going to win the election can really only tell you so much about what's going on with voters. So it's a really good idea to look for findings that go beyond the horse race and the question of who's going to win. But also understand that policy preferences as measured by polls are not necessarily predictive of election outcomes. Another thing that's really important to pay attention to is what polls can tell you about key subgroups of voters, and not only how issues may factor in their vote choice, but also how they factor in their motivation to turn out. Another point is that polls can really also help you understand people's experiences and gaps in voter knowledge. And those kind of data can provide really good context for a story. They can also help you identify areas where stories can help inform. And then finally, I would be remiss if I didn't make this plug coming to you from the APOR conference, which is full of survey nerds. Pay attention to survey methodology when polls come across your desk. And if you don't feel equipped to judge the quality of polls on your own, make a survey friend who can help you. And with that, I will pass it off to Claire, who I think is going to moderate our discussion.
Absolutely. I am just very excited, Liz, that you could join us today and that our other panelists could join as well. So I'll invite Liz, Rachel, and Annie, all three of you, if you can press the tiny little button on GoToMeeting and join our panel here. So I really learned a lot, Liz, from reading through your survey research. Thanks so much. Rachel and Annie, I'm so excited that you're joining us as well. Allison mentioned that I've worked in communications over the last 20 years, so I have a lot of experience with both looking at survey data and also working with members of the media. And I think this question of how does the conversation around the election and how people think about policies and how this story gets told is a really interesting one, right? Because, at the Alliance for Health Policy, we work with folks who are working every single day on the line items of what goes into policy. And when they sort of see it on the big stage of the general election, it can look very different. So I'm excited to have the conversation of not just how voters perceive these issues, but also then how do they translate into the discussion when it becomes a policy discussion. So with that, Liz, I think you mentioned that, this is not a healthcare election. And I'd love to hear a little bit more from you about what makes something a healthcare election, and were there other elections that you can think of that fall into that category or meet that criteria? I'd love to hear a bit more.
Yeah, I think there are certainly different ways to define a healthcare election. If we think about what is defining how voters are thinking about the candidates in this election, I don't think anyone would think that that healthcare is at the top of the list, given the two candidates that we have. If we think back, there have been previous elections that have happened in the midst of a bigger national health reform debate before the ACA was passed, particularly Democratic primaries, right? If we think about the 2008 Democratic primary and then even the 2008 general election, we were having a much bigger national focus on a health reform debate. Or if we think about the 2016 Democratic primary, we think about Bernie Sanders and Medicare for All, right? There have been elections in the past where I think we've had a more robust discussion from the candidates about different directions on healthcare. And that's not to say that there are not huge differences in the ways that President Biden or former President Trump would approach healthcare. There are certainly huge stakes for healthcare in this election, but I think in terms of the voter perspective, I would say that it's not a healthcare election from that perspective.
Got it. And then Annie or Rachel, do you have thoughts on that?
I can jump in here. I think that, first of all, Liz, your presentation was wonderful. I really enjoyed listening to it, and sort of very selfishly. And I think it's right with these two candidates. Healthcare is not one of a major theme necessarily, but when you think about presidential elections in particular, I think it's so important to remember that the electorate is split, nearly almost 50-50, and elections are won by turning out your base, turning out your voters, and getting, persuading a very small sliver of independent voters to go your direction. So the issues that voters writ large are interested in are not necessarily what the candidates will or should be talking about. And I think that is, when you go back to abortion, there's an issue that does two magical things for Democrats, right? It gets their base really enthusiastic. Their base has shown a willingness to go out and vote on that issue. So it turns out their base in an election where the candidate himself is not particularly charismatic and it does not have that, is not attracting the sort of enthusiasm that you normally would see. So abortion is helping with that. But abortion also helps with persuasion for Democrats. There are some suburban women who are Republicans who are really uncomfortable with where the Republican Party is taking the country on this issue. And so for that reason, it does have some magical qualities that do put abortion, make abortion an issue that, while most of the country is probably not so interested in, it does hit two really key things for Democrats. And I will also say, I think that the data on prescription drugs and older voters was fascinating. That's a key part of Biden's accomplishment is that he has been able to, for a very small number of drugs, for a small number of people, negotiate a lower price for prescription drugs. And he has not been getting credit for that. But if the data is showing that is changing, that's very good news for his campaign, because that is a key accomplishment. So those are just the two takeaways that I read. And I'll also say older voters is one of the areas where the president does particularly well. And if you look at his coalition, there's a lot of attention on areas where it's fraying, Black voters, young voters, Hispanic voters. But one of the really sort of bright spots for him in the polling is older voters. And so I just think there's something pretty fascinating going on right there.
That's so interesting. I hadn't thought of that. Rachel, do you have thoughts on what makes a healthcare election?
Sure. Yeah, Fred, even just thinking from a policy perspective about 2020, during every debate, we would almost roll our eyes and be like, all right, here we go. They're going to fight about the public option and Medicare for all again. And neither of those things have come to pass. And I think kind of the lack of a competitive primary on either side here has really mitigated the need for candidates to put forward inventive or new policy ideas. Like, we kind of know where each of these candidates stands. Their ideas are well known, and I think both of them have things they would have liked to accomplish that didn't quite get done. And so it feels like they're more arguing about a continuation of the things that they've already proposed instead of proposing new ideas.
That's so interesting, because it's like a structural reason that the conversation isn't going into more depth on the policy side. And that's not something that I had thought of before. And that makes it harder then, right, to cover it as a story, because it doesn't seem relevant, because there's no difference, right? Like, you're not looking at different approaches on the DNR side. So there's nothing at stake. Is that what makes sense, Rachel?
I think there are stakes. There are differences between the two candidates, but in terms of differentiating from their prior positions,
right,
in a competitive primary, they have to seem different from their opponents. And so they have to give voters something to be excited about or inspired by, or that they feel would make their lives better. And they just have to be less imaginative here, because it kind of went to kind of that stark contrast so quickly between Democrats and Republicans, where there are clearly differences, there are clearly stakes, but both two former presidents, or current and former president, both of them have laid out their agenda kind of through their actions.
Yeah, that makes sense. You've said it better than I did. Yeah, there's more nuance, right, in the policy discussion when you have that earlier round, if you will.
Right.
Great. So one thing I noticed in the data is that the affordability responses, it struck me that 3 in 4 adults say that they're very worried or somewhat worried about unexpected medical bills and the cost of healthcare services, which Liz, you pulled out. And that's higher than gasoline or transportation costs or electricity and heat and food. And the reason that struck me is, as somebody who's paid a lot of attention to media over the years, is that gasoline prices, when they are higher on that list, really dominate the conversation. So I have a question for our journalist friends, which is, what do you think makes this different? When healthcare is at the top of that list, how come that is covered a little bit differently than when it's gas prices?
I mean, I think it's just the healthcare prices are just so opaque. I mean, like gas prices like could not be more transparent. Like you drive by them every day, they're like flashing in giant lights, you know exactly how much to the penny, you know, one competing gas station is against the next. And then you also know, golly, it's at $4 a gallon. This is ridiculous. Whereas healthcare, I mean, you're never gonna know. You know, you don't know how much anything's going to cost until you get a bill and then argue with your healthcare provider about that bill. You know, somebody who just got a very surprisingly big bill. So, you know, I think that like if there was that kind of transparency in healthcare pricing, you know, and you'd see those stories, and in instances where there have been, like when you saw that price of insulin really rise a few years ago, there was just this, all of a sudden it did become a really big issue, and it's because it was just more easily digestible, and it wasn't like these prices that are like layered into like multiple, you know, they're just coated in cocoons of obfuscation. So I think that once it's more clear, then it is an easier thing to have as part of the public conversation.
Yeah, I agree. I think Annie covered kind of why it's covered less. I think it just struck me as interesting because the respondents chose overall concerns about healthcare costs over prescription drug costs. And I think that has been very much a populist kind of trend that we've been seeing in public opinion polling that hasn't really reflected in the policy space as much. It's not popular to go after hospitals. They're huge employers. They're really politically powerful. They spend so much money lobbying. But we have seen this groundswell of concern from consumers about getting large medical bills, about being surprised. And we know that bills from doctors and hospitals are more likely to be part of consumers' medical debt when they're carrying medical debt. And so I think the sticker shock at the pharmacy is still a problem, obviously, given Liz's polling, but I thought it was kind of interesting to see how that public opinion could be shifting, but we may not see as much criticism of providers just given the nature of politics and health policy and where we are today.
It is complicated, and there are lots of players. I think it also has interesting connections to the other slide about Social Security, Medicare, and Medicaid, right? So Liz, my question is, you know, if this is a pocketbook issue, then does that translate with voters to a specific party preference?
You know, it's interesting when it comes to the pocketbook issue of healthcare, because we, you know, historically, Democrats tend to have an advantage over Republicans on healthcare in general as an issue. But when we start drilling down and asking which party or which candidate you trust more on specific parts of healthcare, on lowering costs, there's a smaller advantage or no advantage for Democrats, you know, partly because Republicans tend to be trusted more on economic issues. So I would say, you know, on the issue of healthcare costs specifically, there's not really a clear advantage for a specific party. But there's also, I think, a sense, we asked a question in our most recent survey about how likely you think it is that either Biden or Trump's policies would bring down prescription drug costs if they were elected. And partisans answered it completely differently, but among independent voters, there was sort of not a lot of confidence that either one of them would do much to lower costs.
It's interesting. So talk about costs. I mean, it just strikes me this concern or support for these existing programs, you know, Social Security, Medicare, Medicaid, and you mentioned even now the ACA. It seems like you know, to me, as someone who has looked at a lot of data, I think, you know, there is this concern or worry, right? And so concern or worry about something being changed or taken away, right? So there's preservation of the status quo in general, right? And then there's also, you know, concern or worry, and then you tie that to the one medical bill, you know, data that shows that people are worried that that might put them in financial straits, or that they're concerned about that. I'm just wondering, you know, that if folks are, you know, concerned about these things, does this differ, Liz, from previous elections? In terms, you talked a little bit about the ACA, but in that support for Social Security, Medicare, and Medicaid, it's sort of support, but it's also this worry piece, right? Like, it's not going to be there for me. And I'm wondering if that has shifted at all.
I would say we had that. Those have been things that voters have been concerned about for a long time. I mean, I'm not going back to, you know, I think each of those programs, when they were passed, maybe took some time to become very popular, just like with the ACA. But I don't think it's new that there is concern or worry about those programs being available in the future. You know, another thing that I didn't show, though, is that, you know, I mean, President Trump has talked about, you know, there's fraud and waste we need to clean up. And if you ask voters, do you think there's fraud and waste in these programs? A lot of them also agree with that talking point. Yeah, so you know, I think that this is something that is a continual concern, but whether that translates into a robust debate about actual policy changes to these programs, I don't see that as being very likely.
Mm-hmm. Yeah, and there's not usually people in polls that are for fraud, waste, or abuse, as we find. It's a majority issue. We're against it. That's great. So are there we talked about abortion as a motivating force for voters to turn out. Are there other healthcare issues that kind of impact turnout? Maybe not as dramatically or as historically documented, but is there any that come to mind? I'd say, Annie, if you want to take that one.
I think on this election, you know, I mean, I really think that is going to be the major, when you think about healthcare and what you're going to hear out of candidates' mouths. Now, I mean, the like targeting has become, ad targeting has become so sophisticated that I was meeting with somebody recently who told me that there's a way to like specifically target individuals who have changed from paying for like a non-generic or a brand name drug to a generic drug. And so an ad could potentially target, you know, Claire. Mm-hmm. I saw, you know, you've recently changed your drug prescription. Did you know that it's because President Biden's law was passed that enabled X, Y, and Z? Like, and I'm not sure that they would do it in such a creepy way like that. But
no copywriting job for you, Annie.
I know. But that, to me, I think what that speaks to is that, well, maybe the candidate isn't going to be saying it, but if you are, you know, looking at your phone and looking at your Facebook page or your Instagram, you may actually start seeing like very targeted ads that do get at healthcare costs and that can specifically know, you know, in the back of the ad maker's mind, they know that you have changed drugs, that you are cost sensitive, and that you are therefore potentially receptive to this message. So I think that's a place that you'll see it. The other thing that, you know, you've seen a little bit from this White House has been policy changes that are in the healthcare space, and they're a little bit around the edges. A big one that we paid a lot of attention to at the Wall Street Journal was the rule on menthol, banning menthol cigarettes.
Yep.
This is something that the White House decided not to take action on, sort of punting this idea of banning menthol cigarettes off until after the election. And that is because the people who smoke these, predominantly smoke these types of cigarettes, happen to be part of Joe Biden's base. It's black voters, black men, and the campaign against it was searing to the Biden campaign. It was sort of there's a very effective lobbying group that sent out mailers to Black voters in South Carolina, which is not a swing state, but this is sort of telling them what they could do in Georgia, which is a swing state, that said, Joe Biden wants to take away your cigarettes. And that's not a great message for the president, even if you want to debate what the policy is. And I think that, there's some people who would have strong feelings on the policy. But so you're seeing the White House making some healthcare tweaks ahead of the election, with an eye to voting and with an eye really in this case to like avoiding an attack ad rather than sort of proactive, this is a great policy that we've done.
Great. Any thoughts, Rachel?
Oh, my thought was mainly going back to, I think, Liz's slides on how the White House has made some progress on awareness of the Inflation Reduction Act and the drug pricing powers. I mean, from a reporter's perspective, the White House has started making, in terms of news value, little mountains out of molehills here. I mean, even when there's some tiny development that was written in statute, not a surprise to anyone, not necessarily an unexpected development. They've had press conferences, they've had, events at the White House. They've really just made a concerted effort to highlight every chance they can that this law exists. And just make sure that the healthcare part doesn't get lost in the larger kind of policy developments that were included in the Inflation Reduction Act, which by its name you wouldn't necessarily think is about healthcare. So I think we've definitely seen a concerted effort, and it's very interesting to see the data that it's starting to pay off for them. And I think you've also seen administration officials, HHS Secretary Javier Becerra, fanned out across the country doing events in local communities, trying to raise awareness here.
Great. That is interesting. I mean, I think, it's a giving and receiving, right? In terms of these messages, and what gets through is sometimes kind of a mystery. The other question I wanted to make sure we talked about, because it kind of framed it up at the beginning, is there's kind of the relationship, right, between the voter identified issues, how they're relevant in the election, how people vote, and then how it impacts policy, right? So we're looking at that little chain, or, which might break in some places, or maybe it's, maybe it's a different shape, maybe it's a circle. So I'd like to start with Liz, and can you talk a little bit about the relationship between voter policy preferences we see in polls and then voter choices, like how they actually vote?
Yeah, and I think when we talk about voter choices, we really also need to include the choice to actually vote, because it's not just deciding between the candidates, it's deciding, am I going to actually go to the polls, or am I going to actually go to the mailbox? And that is why we talk a lot about voter motivation. I think policy preferences are a small part of what voters consider when making those decisions, but it can really matter. If we talk about, our CEO, Drew Altman, likes to talk about the tight election as a game of inches. So it's not about everybody making these policy decisions, but it could be that a few voters who really care about a specific policy could make a big difference. But I think another thing we really have to keep in mind is that voters don't have the same understanding of policy that all of us do. So, for example, if we talk about the ACA's protections for people with pre-existing conditions are very popular. But we've done polling where we find that fewer than 4 in 10 people actually connect those protections to the ACA itself. And so talking about taking away the ACA, unless it's explicitly connected to pre-existing conditions in an ad, is not going to make that connection in voters' minds. Only 1/3 of the public knows that the uninsured rate has decreased since the ACA was passed. Only 1/3, when we asked them, knew there was a record number of signups for the ACA marketplaces in the most recent enrollment period. And so I think when you're thinking about policy preferences with voters, you have to take into account the level of understanding and awareness that the average voter has. The average voter who is trying to put food on their family's table, and has a lot of other things to think about. So
it's not their top priority.
Not for everyone.
That's great. And then Annie, I would ask you, what do you see as relationship between like polling on issues like the healthcare issues identified here and how an election actually plays out, or what the results might be, since you've covered quite a few?
Yeah, I mean, it's really tricky. I think that Liz is really wise in how she kind of laid out how you want to look at these polling, and particularly issue polling. It can be so much more useful than a horse race poll, which I know gets all of the headlines and kind of people commit them to memory. But I think that what this poll shows is like the kind of broader forces and kind of plate tectonics that are beneath those horse race polls. So, I think that like, especially this far away from an election, these are just much more helpful documents, and it's much more helpful data to be sifting through and thinking about, because it does help you understand and connect, like, okay, why is the White House all of a sudden doing press conferences, like Rachel pointed out so wisely? Why is the White House all of a sudden doing press conferences on this like this little tiny change, or this very minor thing is getting attention from the White House? And I think that's where you see the connective tissue, is the White House is seeing that those broader forces and reacting to it and trying very hard to be in sync with the where the public is. So I think that this kind of data is just so helpful in just helping to understand like why the conversation is going where it's going.
Great. So it's helpful in like framing and creating that sort of general understanding as you go.
Right. I mean, I think, to Rachel's point, like you see that, okay, the White House is going to do 5 events this week, and all of them are really, really minor, but they are all surrounding, prescription drug costs. And you can see, okay, that is being responsive to this much larger pool of voters who are like saying that costs are among their biggest concerns. And I would add to that we've talked a lot, and of course this is about healthcare, and this not being a healthcare election this year, but it is an economic election. And you will see, I was talking to a White House person recently who was saying that, they had what they felt was a very good week. Trump was in court every single day. The White House felt very good about just their day-to-day moments. But, really bad inflation data came out. It's not this week, it's a previous week. Bad inflation data came out, and that just killed their internal polls for the week. And so, when it's about healthcare costs, I think, this very much will be a driving force of this election when costs are associated, whether it's healthcare, housing, mortgage rates, interest rates. But healthcare certainly is a driver of costs, and that is something that voters have been saying is on their mind. And I think, particularly in the swing states, but when you talk to almost any strategist, they will say, yes, there's the atmospherics, there's the, issues that Trump has with various trials, there's Biden, there's his age, but the kind of force that is, that both campaigns are really contending with is just sort of this concern over the economy and costs and inflation, and healthcare does, kind of dovetail right in with that.
Yeah, and that tracks really well with what Liz shared with us.
Yeah.
Rachel, my question for you is, what's your observations on the relationship between healthcare election issues, which we've talked a lot about, and what actually happens in health policy? So maybe after the dust has settled.
Yeah, I think there's much less of a relationship than people might expect, because after the election, everyone takes their power, all the positions get filled, and these issues are only one factor in a whole vortex of other forces that shape the political and policy process, especially in Congress. And I think, again, going back to Medicare negotiation, that was a perfect example. I mean, that had just generally as an issue 90% support from voters, and it took lawmakers, specifically Democratic lawmakers, 20 years to get it across the finish line. And toward the end of when the debate over the bill in Congress, Senator Bernie Sanders took to having this poll data that he had printed out and would wave around at reporters when he wanted to kind of make the point that we have to pass this now. It's wildly popular, but that we've seen in other cases where sometimes even wildly popular issues like capping copays for insulin just kind of get stuck. And right now, Congress is stuck on capping insulin costs for people with commercial insurance. And so there's absolutely cases all the time where voters might think a policy is a good idea, but that doesn't necessarily translate to action when lawmakers or the president actually gets into office.
Great, that's a great example. So yeah, the voice of the people, and then when we get into policy making, maybe there's like a translation there, or a little
what we call the sausage process. Yes.
Yes. So we are going to now go to Q&A, and I've gotten a few through the magic of GoToMeeting to share with you all. And I'm going to start with you, Liz, because you were just talking about awareness and kind of the generally low level of awareness among the general voting population around policies. One of our participants asked, how aware are voters of the expiration of, after 2025, of the ACA enhanced tax credits, insurance tax credits? And there's a question here about prospects for extending them as well. If there's any research on that you have any knowledge of, I think that would be helpful to share.
Yeah, we have not polled on awareness of that. I would guess that people are not very aware. We have asked about support for extending them, and majorities of people do support extending them, but I will just caution that is, when there's lack of awareness and general support for something that says, yes, we should continue to help people, we've been helping, that would be an expected result. One thing we haven't done with that type of question that we try to do when we have space is to say, well, what are the trade-offs? Would you support this if it meant your taxes would be higher, or other costs would go up? So I would just caution for interpretation of results finding support for sort of low salience, low knowledge programs, and just kind of keep that in mind.
Yeah. So a couple of people asked a version of this question, and I'm not sure if we're far enough in to have an opinion on this, but there's a question about in the Senate or House races. Is there a difference that anybody has noted between how the state level races are conducting or might look at healthcare, or maybe perhaps I could add to that, any examples you've seen in the past versus what we're seeing at the presidential level? I don't know if anybody has thoughts on that. Like how it's playing out in the state versus how it might play out in the presidential. Annie, I think you had a Georgia example.
My sense for that is a lot of this rhetoric, a lot of it just comes from the White House. A lot of, you don't see a lot of daylight on issues like this between Democrats, at least, where I have spent most of my time focusing. Again, going to abortion, I think that is one area where an IVF, those are two kind of healthcare areas where I think the Republicans have had a little bit more difficulty kind of coalescing around one particular position, and have found themselves on their back feet and kind of looking in real time to how to talk about and how to focus on the issue. I think that has something to do with the fact that they're not, in power, and there's less of a kind of clear messaging structure. And there are other factors involved as well, of course. But I think when you look for state to state, it's going to kind of come down to there are some states like Arizona, Florida, obviously, that have older populations, where prescription drugs is going to naturally be more of an issue than in some of the more the younger states. But you're not really seeing Democrats kind of break with the president on health care issues the way that you do on the Republican side. See a little bit more fluidity in their positions on some of the kind of key key issues of the day and that connect to healthcare.
Makes sense. We have a couple of questions here on the role of private equity and just how that's been kind of picked up by media. Does anybody have thoughts about whether or not that might sort of become part of the consciousness around some of this cost conversation? Has anybody seen any, have you seen any data on that, Liz?
No, but I have folks within my organization who would really like me to poll on it. We have not gotten around to it. And honestly, I'm not sure how much of that conversation has trickled to voters and the general public, which is why we haven't found space to ask about it in our surveys. But I know it's a topic that a lot of people who are really focused on health policy are paying attention to, but I don't have any data about the general public.
That makes sense. I think that's another area where, you know, I think this is an area, and Rachel, I have another question for you that I think is going to build on this, which is like sometimes you talked about things getting stuck, and sometimes things get stuck in relationship to that complexity, right? Like the understanding that people just don't actually know, and sometimes actually it moves faster because of that complexity and people don't really understand it. And with that in mind, I think we have a question here around, you know, there's this general concern that we're seeing around cost and certainly personal sort of security tied to health programs. But, you know, I think you and I had talked earlier about, you know, the Lower Cost, More Transparency Act, right? And is there then, does that translate into more enthusiasm for policies like that one in real life in the policymaking world?
So with that bill specifically, you can call a bill the Lower Costs, More Transparency Act, but if it doesn't actually lower costs, like I don't know how much that's going to move the needle. Certainly there are provisions of the House bill that kind of get at the back door, kind of behind the curtain machinations of the healthcare system, but it doesn't quite have the appeal of like a $35 insulin copay cap, you know, with PBM reform, you know, so maybe some voters will know what a PBM is, you know, if they take a lot of medications or familiar with their formularies or what they're paying at the pharmacy counter. But I think there's not a lot of understanding about a lot of what lawmakers are debating in this specific bill. You know, if we're talking about site neutral payments for hospitals or, you know, outpatient departments. I mean, this is just over a lot of people's head, frankly. And not that it wouldn't have impact for healthcare system costs on the back end, but in terms of actual policy change, given that many of the transparency measures are already mandated by regulations, they just haven't been made you know, in statute. It seems like it's kind of more of a back end thing than something people could really see or feel in a tangible way.
Makes sense. I mean, I think we're all, it's very interesting in this conversation. There's a lot of focus on policy being self-explanatory, right? Or the value of the policy being either clearly articulated or self-evident, right? That seems to be a big part of what sort of travels when you're up against, I think, Liz, like Social Security has been around for a long time, right? So people know that's what Social Security is because they've experienced it in their day-to-day lives, you know, so you see that, you know, the retention kind of care is very, very high. And then it goes down from there is like how long the programs have been around. I mean, so it just takes a while for people to understand what the benefit is in real life, and some of the other policies like you're talking about that actually are more, you know, understandable or self-evident, you know, it becomes an easier water to carry on the policy side as well. We had a couple other questions. I think we talked a little bit. Someone asked, like, are there any lessons learned, but why Americans are not aware of the IRA piece we talked about. And I wonder if there's more there in terms of what does it take? You know, are there policy, you know, decisions that we've seen in healthcare that have broken through? Maybe some that were surprises, maybe some that weren't self-evident. Are there any examples that we can think of where, you know, it captured imagination or really kind of resonated into the conversation that maybe wasn't intended. Does anybody have any thoughts on that? Because I'm interested in knowing, right? Because I think every administration is going to use the bully pulpit to say, we accomplished this, we accomplished that. What's really interesting is what happens after that. Like, does it actually land? Does it resonate? Does it get picked up? Does it get repeated? How does it get received? And that is such a complex process that it's kind of interesting to think about what does and doesn't land. I don't know, Liz, go ahead.
I think what's really tricky is that, and this is, you know, every administration has this problem with every piece of major legislation, but like the gap between like the rhetoric and what people actually feel and see is just like so hard, so large that it's almost impossible to measure. It's so big. I mean, if you have the president of the United States going around talking about, look, we are lowering the cost of prescription drugs for you, and then you go to the pharmacy and you don't happen to be a senior, or you don't happen to be using one of the like handful of drugs in which they are actually, you know, negotiating the price for, then you're going to be like, oh golly, like I didn't notice that. And so you're going to go from being like, wow, good job, president, to, hey, you know, am I going to believe you, or, you know, my lying eyes? I mean, so I think like these programs are complicated and progress is slow, and Democrats have been talking about lowering, you know, negotiating to lower the price of prescription drugs for like 20 years. And so like, I can understand from a voter's perspective, kind of tuning out that message. And then particularly, you know, you have to start actually seeing it. And this is where I don't even think it's a messaging problem. It's a like problem, you know?
Makes sense.
I think if we're looking for an example of where it turned out differently, right, with the Medicare Part D, you know, I think there were some things where seniors would get a benefit right away, right? And so there was, even though most of it took a long time to implement, there was something that came to them right away, and then that kind of helped that program more quickly become popular, because a lot of people were really skeptical about it when it passed because of the role of private plans and how confusing it was to choose a plan. And so I think that could be an example of where a policy was rolled out with a slightly different outcome in the public's mind.
Or IVF, I think. Like all of a sudden, you know, a judge made a decision that paused IVF for, you know, many, many women. And I think, you know, that caused a sort of an instant like, oh my gosh, now we're all talking about IVF. So it's I think there has to, like, when there's a connection in real time, I think that really helps something break through. Whereas if it's a small change that will affect a small number of people quite a few years from now, yeah, that's going to be a hard sell when people are pretty busy with many other more immediate things on their plate.
Great. Well, I know we're almost at time, and I did want to give Liz the last word, just in terms of, are there any cautionary, you know, nuggets that you'd like to share with us in terms of how, when we look at polling, to think about how to tell a story? What are the do's and don'ts?
Okay, I really appreciate you giving me like 2 minutes because I am at the APOR conference. I mean, I will just say survey methods have gotten exceedingly complicated. But one thing that we really talk about at APOR, where I am right now, is transparency. If you can't find the exact questions that were used in a poll and the order they were asked in, if you can't find how the sampling was done, who was interviewed, that to me right there is a red flag that, you know, you just don't know enough about the methods to even ask somebody how to evaluate it. And then I would say that APOR does have some great resources on their website, apor.org, on election polling resources to kind of help you understand some of the basics of how polls are conducted and how to tell, you know, there's no sort of gold seal of approval, but there are some questions that you can ask to kind of help yourself be a better consumer of polls.
And it's American Academy of Public Opinion Research, right? That's APOR?
Yeah, American Association of Public Opinion Research, yes.
Great, they got a lot of plugs here. It's great. We're all for good quality research. I want to hand it to Allison just to wrap us up here. And I just want to thank each of our panelists. Really interesting and novel conversation. I really appreciate you joining us.
Thank you, Claire, Liz, Rachel, and Annie for joining us for this important discussion today. And I want to thank all of you in the audience who took the time out of your busy day to be here and ask these fabulous questions. Before you go, we want to hear from you. We appreciate you taking a few minutes to complete the brief evaluation survey that you'll receive via email later today, and that the team will be dropping in the chat here. Here at the Alliance, we host educational webinars and in-person events throughout the year, so please visit our website and sign up to receive the latest updates about our upcoming events. You can see a few of those listed here. The Alliance is excited to host an exclusive office hours session coming up on May 29th. Ask the Experts, Understanding Polling and Health Priorities. This will be a great opportunity to get one-on-one time with some of our experts here to ask Liz or Rachel any questions you have from our webinar today. This opportunity is only being offered to you on this webinar, and a select few, and spots are limited, so be sure to keep an eye on your inboxes for when we send out registration details. And in a few months, the Alliance will be hosting our 2024 Signature Series Summit on AI and Health, Navigating New Frontiers. This free in-person event will be held July 25th here in DC, so please sign up to receive those updates and our registration link when it's live. We really hope to see you there. Finally, as a reminder, a recording of this webinar and additional materials will be available on the Alliance website. And this concludes today's conversation. We hope to see you at future Alliance events.